Hi everyone. In today's clip, I will talk a little bit about OCD. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please consult your healthcare provider. So OCD, or obsessive compulsive disorder, is a chronic mental health condition which is characterized by obsession and compulsion. Obsessions, which are sort of intrusive, unwanted, and distressing thoughts. For example, a fear of contamination, fear of harming someone, and so on. Compulsions, which are repetitive behaviors or mental rituals done to reduce anxiety, like hand washing, checking locks, counting, and so on. This affects about 2 to 3% of people worldwide, often starting in adolescence or early adulthood. The conventional medical approaches to this are psychotherapy, cognitive behavioral therapy or CBT, with exposure and response prevention, which is ERP. This is a gold standard and the first line of treatment for this ailment that involves gradually exposing a person to their obsessions and fears while simultaneously sort of preventing them from performing their compulsive behaviors. This process is a modified form of cognitive behavioral therapy or CBT, and it helps individuals learn to tolerate distress, break the cycle of obsessions and compulsions, and develop new coping skills to manage their symptoms without resorting to rituals. The goal of this treatment is to reduce anxiety, break the OCD cycle, and develop coping skills. Most prescribed medications are there sort of to target serotonin pathways. Now, just to give you a little bit of background, serotonin is a hormone that carries messages between nerve cells or neurons throughout the brain and body, regulating mood, sleep, digestion, blood clotting, and bone density. So they may prescribe SSRIs or selective serotonin reuptake inhibitors like Prozac or Zoloft and more. And short-term side effects vary from nausea, diarrhea, headaches, insomnia, drowsiness, sexual dysfunction, weight changes, and withdrawal symptoms if stopped abruptly. And if it's prolonged, if long-term side effects are known to be emotional blunting, sexual dysfunction, weight gain, sleep issues, increased risk of bone fractures, and bleeding, potential links to higher risks of diabetes, cardiovascular disease, and cognitive impairment. This medication has interactions with St. John's wort, 5-HTP, SAMe, causing risk of serotonin syndrome. This is a serious drug reaction. It is caused by medications that build up high levels of serotonin in the body. Many of these medications also interact with migraine drugs, blood thinners, and or alcohol. Next in the list of medications that may be prescribed is clomipramine, which is one of the earliest OCD drugs, very effective, but many more side effects. So short-term side effects can be dry mouth, constipation, blurred vision, weight gain, sexual dysfunction, arrhythmia, and if continued, low blood pressure, vision loss, trouble passing urine, seizures, and a whole lot more. There's a long list of them. So when it comes to interactions, shouldn't mix this with alcohol, sedatives, or SSRIs, and definitely check the list of other medications that this has interactions with. The doctor also may recommend augmentation strategies. This is basically another name for medication that more medication, and it involves adding medications or therapies to a primary treatment, such as an SSRI, to enhance efficacy in patients with a partial or poor response. So if SSRIs don't work alone, doctors may add antipsychotics and mood stabilizers, for example. On the holistic and complementary side of things, mindfulness meditation reduces intrusive thoughts, helps observe rather than sort of react. Yoga and breath work to lower anxiety, balance autonomic nervous system. Exercise, regular aerobic activity improves serotonin and dopamine functions. Sleep hygiene, poor sleep actually worsens OCD symptoms. On the nutritional, and herbal sides, inositol, which is a B vitamin-like compound that supports serotonin signaling, is important. 12 to 18 grams a day in powder form, mixed in water, but needs to be split throughout the day. Side effects can be mild nausea and diarrhea at high doses. This is generally safe even if the person is on SSRIs. Then we have N-acetylcysteine or NAC. This works on glutamate system, which is often dysregulated in OCD individuals. The glutamate system is a network of glutamate neurotransmission in the central nervous system, where glutamate acts as a major sort of excitant neurotransmitter, essential for functions like learning, memory, and mood regulation. This will be about 600 to 2400 milligrams a day, and the side effects can be mild gastrointestinal upset. It may interact with nitroglycerin, charcoal, and some chemotherapy agents. Next on the list is St. John's wort, which sometimes helps with OCD, depression, sort of anxiety, but it interacts strongly with SSRIs and clomipramine and birth control pills, anticoagulants, and should not be combined with conventional OCD sort of meds. Next in line, we have turmeric or curcumin, which is an anti-inflammatory and it supports brain function. Side effects is it may thin blood and cause mild GI upset. If the person is on blood thinners, this is not recommended because it also has blood thinning effects. Then we have ashwagandha, which is an adaptogen. Hence, it reduces the anxiety and stress response. As for side effects, it can cause drowsiness, a little bit of GI upset. So avoid this with sedatives, thyroid medications, or immunosuppressants. Then we have valerian root, passion flower, and chamomile to help with anxiety and sleep. So obviously they may cause drowsiness and may enhance sedative effect of a drug. Next, we have vitamins and minerals like D3 plus K2, because low levels of these are linked with anxiety and OCD. But excessive doses can interact with medications like digoxin and diuretics. So the dose will be between 1,000 to 5,000 international units a day, depending on the blood levels. Then we have magnesium, glycinate, citrate, or threonate, now, which are brain penetrating and calm the nervous system and reduce anxiety. Though the dose would be between 200 to 400 milligrams a day. High doses can cause diarrhea, especially if you're taking citrate. So unless the patient is constipated, usually glycinate or threonate are preferred. Magnesium can also reduce absorption of some antibiotics, so you would need to take it 2 to 4 hours apart. Then there is the B complex vitamins, especially B6, B12, and folate, which supports serotonin and dopamine pathways. B6 or pyridoxine would be needed in about 25 to 50 milligrams a day for serotonin and GABA synthesis. But keep in mind that over 200 milligrams a day for long term can cause neuropathy or nerve tingling, which will go away once you stop it. It also has interaction with medications for autoimmune disease. Next, we have B-complex in the B-complex family, we have B12 or methylcobalamin or hydroxycobalamin, 500 to 1,000 micrograms a day. This can be sublingual or oral. It is safe, and the excess usually is excreted in urine. Next, in the same family, we have folate, or methylfolate, or L5-MTHF, 400 to 800 micrograms a day. Don't mix high-dose folic acid with methotrexate, which is an autoimmune disease and cancer sort of drug that is prescribed. Next, we have omega-3 fatty acids, EPA and DHA, which are anti-inflammatory and support brain connectivity. 1,000 to 4,000 milligrams a day combined EPA and DHA daily. This is especially calming for mood and for compulsive sort of symptoms. It may thin the blood, so don't use it if you're on aspirin, warfarin, or any other anticoagulants. Also, general multivitamin and trace minerals such as zinc, 15 to 30 milligrams a day. It helps with serotonin and dopamine balance. Iron, if only deficient, otherwise avoid excess iron because it increases the oxidative stress. Selenium, 100 to 200 micrograms a day because it supports thyroid and the mood. On the emotional and metaphysical side of things, fear of loss of control is one of them because rituals sort of provide a false sense of safety. Suppressed anxiety or guilt. So compulsions usually act as a way to neutralize perceived wrong thoughts. Perfectionism or fear of mistakes, because obsessive checking, order, and counting is sort of to counterbalance that. Emotional rigidity, difficulty trusting life's flow. So as I have mentioned time and time again, dealing with emotions obviously is extremely important. And if I sort of summarize this in an integrative healing approach, OCD patients would need to do combined therapy of emotional healing, ERP, CBT, medication only if required, only if it is severe, nutritional and herbal support, and mind and body practices. Hope this has been helpful. Like and follow for more. Be the light.